Congratulations on starting your whitening journey. This video is to go alongside the instructions you've already been given by your dentist, just to help you with the whitening process at home. Now, the main things to remember before you start is to make sure you refrain from eating or consuming any kind of very staining foods. This will just hinder the whitening process, which will mean it'll have to go on for a little bit longer. Examples of this are teas, coffees, red wine, curries, saffron, beetroot, things like that. Now we're going to go through what you're going to receive inside your pack. Inside your bag, you will receive custom-made trays. These trays have been made from a model of you, so they fit only you. You have a lower arch and you have an upper arch. You will also receive 8 gels in total, which will be presented as 4 and 4. You will also have some additional advice sheets inside should you need them, and a special brush to help with the cleaning of your trays. So with your gels, ideally you want to keep them in a cold environment such as in the fridge or in a room temperature room. Definitely don't keep them in any direct sunlight or in a hot or humid room such as the bathroom, as this will deactivate the gels. So each gel should last you a total of 2 nights. Quarter should be used for the upper arch, a quarter for the lower arch over 1 night, so a total of 2. You will get 8 syringes within your pack. That means you should get roughly around 16 nights of whitening. This also depends on and is tailored to you. If you have a very wide smile, you might want to use a little bit more. If you have a very narrow smile, you might use a little bit less. I'm now going to show you how to load the trays. Before we do that, I just want to explain that each gel has an expiry date on them. This shouldn't matter too much during your initial whitening. However, if you were to purchase additional gels and not use them, just make sure that the gel is within the expiry date, otherwise it will be inactive. Each gel has a breakable tip on the end. You just need to break that off. You can then use the reverse side to seal it over after you've finished with the whitening. So you take the tip off and you position the tip of the gel in the middle of the tooth here. We always want to make sure we're whitening the outer circumference of the teeth, not the inner circumference, to make sure that we're getting the best results. As you can see there, we've got a small blob in the middle of the tooth. You then work your way all the way around to the first molar, or when the dentist has told you to stop whitening. Once you've fully loaded the tray, you then need to seat it very gently on the edge of your teeth. Do not press the outer part of the tooth, otherwise you're going to push all of the gel out on the top. You need to just gently press against the tip of the teeth and then slowly slide it on either side until fully seated. If you do get some excess gel coming out the top of the tray, just make sure to wipe it away gently with some tissue. I'm going to demonstrate on myself. So you make sure that you press the tip of your front teeth in first and then move either side, left and right, to make sure fully seated. And that's it. This whole process of fitting your trays is to be done as the very last thing that you do at night. After you've brushed your teeth, after you've flossed, after you've finished drinking water, this is the last thing you do at night, unless instructed otherwise by your dentist to do daytime whitening instead. In the morning, when you wake up, you will take your trays out. They might be a little bit sticky from any excess gel that is there. You make sure that you brush your teeth as you normally would, and you can use the brush that we've provided for you to make sure that you clean the tray thoroughly. Do not rinse under hot water, as this will distort the tray. After you have brushed your tray and you've cleaned it thoroughly, make sure you use tissue and make sure you thoroughly dry it before placing back inside your box. Do make sure you put it in your box, because pets love them. If they're in tissue, they're likely to be thrown away, and we want to make sure we keep them nice and safe. As you're whitening your teeth, you will always notice that the tips of your teeth will whiten first. The reason for that is the tips of your teeth are a lot thinner in comparison to the top part of your teeth. As you continue whitening, this will become more uniform. The other thing you might notice is whitening can sometimes bring out the natural discrepancies that you have in your teeth. You might notice some banding, you might notice some white spots initially. Don't worry, as you continue through the whitening journey, the colour will become much more uniform. The main thing to note is during the whitening process, most people experience some level of sensitivity. For some people, it's very mild and it will subside after a few hours. For others, they might get some more severe sensitivity that could last up to 24 hours. Our advice is if you feel the need to, you can take some painkillers, paracetamol for example, or you can tailor how often you whiten to see how it suits you best. For most of our patients, we would advise if they are getting severe sensitivity to take breaks in between their whitening. So some people might do 3 nights on, 2 nights off. Other people might whiten one arch and then the other. All it means is it will take a little bit longer to do the whitening process. You will still get to the end result, it will just take a little bit longer. As your trays are custom made to you, providing you don't have any other restorative work afterwards, your tray should fit you for many, many years thereafter. If, however, you're having whitening done as a prerequisite to any other restorative treatment, you may need to have new trays made at the end of your restorative treatment to fit the new shape and profile of your teeth. And remember, tooth whitening only works to change the colour of natural teeth. It does not change the colour of any kind of dental material, such as composites or ceramics. That's why it's really important to complete dental whitening before you commence on any kind of restorative journey so that we can match the treatment to the new shade of your lovely white teeth. Good luck with the journey.